Mr. Martin, I want to listen to your lungs.
To apply a nasal cannula or face mask, first assess the patient and check the physician's order for the prescribed oxygen delivery method, flow rate, and duration of therapy. Then attach a flow meter to the oxygen source and connect that to the delivery device using oxygen tubing and extension tubing if needed. Adjust the oxygen flow to the prescribed rate and check that the humidifier is working, as shown in the video skill, Setting Oxygen Flow Rates. Now check that oxygen is flowing through the oxygen delivery device and ensure that it fits properly. For a nasal cannula, place its tips in the patient's nares and adjust the plastic slide until the cannula fits snugly and comfortably. For a reservoir nasal cannula or oximizer, put it on the patient in a similar way, but with the reservoir under her nose or hanging like a pendant. If the patient will have a simple face mask, place it securely over his mouth and nose. Then adjust the headband for a snug and comfortable fit.
How's that? Is that comfortable?
When a Venturi mask has been ordered, assemble the mask by selecting the appropriate barrel to deliver oxygen at the prescribed dosage. Be sure to adjust the oxygen flow rate as indicated on the barrel, or according to the manufacturer's instructions. Apply the mask over the patient's mouth and nose to form a tight seal. When your patient needs a partial rebreathing mask, make sure that the mask seals tightly around her mouth and that the bag fills on exhalation and slightly deflates on inhalation. A non-rebreathing mask has valves that close so exhaled air doesn't enter the bag. To use it properly, ensure a tight seal around the patient's mouth and nose. As with the partial rebreather, make sure the reservoir bag fills on exhalation and partially deflates on inhalation. This prevents room air from entering and decreasing the fraction of inspired oxygen. For a face tent, apply the tent under the patient's chin and over her mouth and nose. Ensure that it fits loosely and that mist is always present. For any type of delivery device, allow some slack on the oxygen tubing for comfort. Make sure a sign indicating oxygen in use is posted near the door to the patient's room. Latex-free products will protect your patient from a potential latex allergic reaction. Assessing the patient's skin integrity behind the ears, in the nares, and anywhere the oxygen delivery device, head strap, or tubing may come in contact with the skin is an important step in determining if there is any allergy to the oxygen delivery products.
Adjust your oxygen for you, Mr.
As part of your follow-up care, check the cannula or face mask every 8 hours, or more depending on the patient's level of care and the facility policy. Humidified oxygen is an option to consider when a patient is receiving oxygen for an extended length of time, at high flow rates, or if assessment reveals dry nasal mucosa.